Hi, I'm Kristen Lyons, and this is my response to question number 3. Why are educational and school psychologists more likely to follow an ecological model rather than a medical model? Gunkin states the nation is facing a public crisis in medical health care for infants, children, and adolescents. Approximately 1 in 5 children and adolescents experiences signs and symptoms of DSM-5 disorder during the course of a year. 1 in 10 children and adolescents suffers from mental illnesses severe enough to result in significant functional impairment. Shifting from a medical to an ecological model is essential in order to address problems with mental health and educational needs. Gunkin states the medical model, which so clearly directs attention almost exclusively toward the internal lives of troubled children and away from school, home, and community environments, thus diminishes the potential impact of treatment programs by encouraging practitioners to ignore vital environmental variables. In an educational setting, the medical model has been a systematic failure. Internal biological and psychic factors are still important in the ecological model. Context and environmental surroundings are just as important. Rather than trying to diagnose student pathologies by using the invalid and unreliable DSM and IDEIA, the ecological model tries to find the best fit between student needs and environmental characteristics. Gunkin states that response to intervention, or RTI, models are among the innovations that have emerged from this point of view. More research needs to be conducted in order to determine if the hypothesized benefits will actually materialize and help to alleviate the mental health and educational pandemic. Gunkin says it is the interaction between internal states and external environments which must be the fundamental unit of analysis for psychologists. In the 17th century, René Descartes created the version of dualism that takes the stance that mind and body are two separate entities. Descartes advocated for natural science through analytic method, which involved the breakdown of a problem into smaller parts and the rebuild of the parts into a logical order. The scientific method was believed to be the only legitimate path to knowledge. This became an issue for social science since it could not completely follow the scientific method because of the risk of incomplete or distorted understanding. Today, mind and body are seen as a unit, a living system, that are integral parts of larger systems, and they interact with their environment. However, mind and body dualism still persists in medicine. Mind and body dualism was a convenient philosophy of the time that fit the complexity of human nature, but it took our focus away from the dynamic nature of human beings, their relationship with the environment, and their real health concerns, and to that extent blocked the development of effective interventions. It's important for educational and school psychologists to understand the history of mind and body dualism in order to know why some of the medical model does not address and adapt to the social science as well as the ecological model. Response to intervention is explained as a multi-tiered approach to assessing, instructing, and monitoring the progress of students, providing instructional interventions to students not performing on grade level, and identifying students who may require a referral to special education. This team develops, implements, and monitors the progress of students that is receiving instructional interventions. A typical intervention team includes general education teachers, special education teachers, and other school professionals as needed. If students progress at a satisfactory rate, then they're responding to the interventions. If they are not, then the non-responders will receive more intense instruction in the form of more time, smaller groups, or additional methods of teaching while teachers use the data gathered to make instructional decisions. When students do not respond to more intense interventions, then they may need special education services. 5 areas were perceived as barriers to the implementation of RTI. The teacher stated that RTI was a burdensome process. Time was listed several times. One respondent said many teachers avoid initiating the process due to the time required. The extra workload and paperwork were also problematic for teachers as well, especially for the general education teachers that had to collect data on more than one student. Participants wrote general statements indicating a knowledge gap, lacking of training in the use of proper interventions, progress monitoring methods, and use of assessment instruments. Teachers are also hesitant to buy into the process of RTI. A lack of resources and personnel with the appropriate training to implement the program were also listed as barriers. The last barrier listed was the lack of education for parents and the lack of involvement of parents in the process. There were three areas were perceived as benefits to the implementation of RTI, or response to intervention. 73% of the statements clustered in the areas that noted students were receiving a higher level instruction because of the implementation of RTI. Students get the help they need sooner and problems are caught earlier. Teachers are providing more and better differentiated instruction based on individual needs, which actually benefits all students. Another benefit listed was that teachers were making better professional decisions in regards to using assessment data to make instructional decisions. The use of research-based interventions for RTI was received as a benefit for teachers and students. Wirtz states another area of benefit to schools was collaboration among teachers and parents. Collaboration also increased among general education teachers and special education teachers. The last benefit listed was that having the steps in place made it easier to implement RTI procedures. Some of the benefits that were listed for students in RTI are that they get help sooner, they don't fall through the cracks, and kids don't have to wait to get the help they need. In a medical model, students would have to wait to receive service. They would have to, in reference to the Humpty Dumpty example in my first article, they'd have to break and have to be put back together. But the ecological model, students can receive prevention and intervention services and not just remediation services. Since school psychologists are considered a part of the RTI team, it's evident that school psychologists follow the ecological model. In the United States, 30% of school districts meet the requirements to be considered for the Small Rural Schools Achievement Program. 36% of the school districts in Texas are identified as rural schools. In rural settings, typically there are no doctors, psychiatrists, or even hospitals. If the medical model had been implemented, many students would not receive the support they need without being taken out of not only their classroom, but also their town. By implementing an ecological model through the process of student intervention teams, these students in rural settings are able to receive educational support, and districts are able to abide by the requirements of IDEIA. The teachers of these rural schools reported progress with their RTI procedures, but did not seem to provide the documentation to support this progress. Brendel states, because progress monitoring is a critical component of intervention, there's a need to provide teacher awareness of methods for effectively monitoring interventions in order to increase effectiveness. Brendel believes that further research that is designed to describe an effective intervention team process will help to establish a more promising model for implementation. Brendel says the findings identified team practices such as problem solving, teacher support, developing interventions, and implementing interventions as more effective than ineffective. From the research conducted with these schools, it was determined that more training that educators received in the area of RTI or student intervention teams, then the more comfortable they feel with the process of RTI implementation and RTI recommendation. These teams also help school psychologists since they are limited in these areas in Texas. When comparing the information from this article to the medical and ecological model, it's obvious as to why educational and school psychologists would use the ecological model. Atkins states, since publication of Bronfenbrenner's groundbreaking theory of human ecological systems, children's development has been understood as influenced by the interacting natural context in which children live, work, and play. The U.S. Department of Education Office of Elementary and Secondary Education states that the No Child Left Behind Act stressed the need to ensure student access to quality mental health care by developing innovative programs to link the school system with the local mental health system. The best way of linking school and mental health is in the classroom setting rather than outside of the school system. Once again, research has supported the ecological model because interacting in natural contexts influences students' development. Educational and school psychologists choose to follow this model because schools represent among the most influential of those contexts by virtue of their long-term influence on children's cognitive and social development. Thank you.